Good afternoon, everyone. Welcome to Reading Live Session with Needus Academy. Vandana here. Yes, so another Friday. How was your day? So do you have any plans for the next 2 days? No plans. Are you guys planning for watching a movie or something? Or exploring any new food items? Or exploring any new places? So please let me know in the comments. I'm waiting here. So yes, what are the plans? Good afternoon once again to everyone. Yes, Shiny, good afternoon. How are you? Okay. So today, as usual, we are going to discuss part A as well as part B. So first of all, we will discuss part B, and then after that, let's move to part A. Okay guys, ready? Alright. So in part B, as you know, we have to complete 6 questions. Okay, and the time that we need is to complete the 6 questions is all about 10 to 12 minutes. Okay, and what strategy that we are using here in part B? Any idea? Good afternoon, Monica. Yes, good afternoon. So, Monica, do you have any idea what strategy that we are using in part B to complete part B? No idea. What is the strategy or what is the method that we are using to complete part B? So please let me know in the comments. Any idea? Very good, Kavita. It is all about elimination method. Yes, right. Okay, so elimination method is the strategy that we are using to complete part B. Okay, so first of all, you can do either, you can read the question first, then you can move to the options, then you can read the paragraph. Okay, so when you read the question, you have to underline the keywords from the question as well as you have to underline the keywords from the options and also from the paragraph. That is the one method. Or else you can read the question first, do the same thing. You can underline the keywords from the question, then you can read the paragraph, then underline the keywords from the paragraph, and then you can move to the options. Okay, and do the same. So I'll show you the question on the screen and I'll give you 2 minutes to complete the question. Alright, so ready? Okay, so the time is over. Okay, so how was it? So this is a memo, as you can see here from the question. So first of all, as I already mentioned, I'll read the question first. Okay, then I'll show you how to underline the keywords from the question. Then I'll read the paragraph first. Then I'll underline the keywords from the paragraph. Then I'll move to the options. Then I'll do the same. Alright, so the question is, the memo reminds the natural therapist not to. Okay, so as I already mentioned, this is a memo. Okay, reminds natural therapist not to. Okay, so please don't do something. So that is the keyword from the question, the major keyword from the question. They are reminding the natural therapist, don't do this. Okay, so memo, we are reading a memo for what? Okay, actually in a memo, in this exam, we have 4 major types of memo. Okay, so that, which are the 4 types? Any idea? Please comment if you know what are the 4 types of memos, you can please comment. What are the 4 types of memo? Any idea? Okay, so memo we are reading for purpose. Okay, in a memo, we are reading the memo for purpose. So the major 4 types of memo which include request memo, warning or reminder memo, advice memo and confirmation memo. Okay, so these are the 4 types of memo: request memo, warning or reminder memo, yes. Then advice memo and confirmation memo. Yes, Monica, very good. Warning memo, yes. Okay, so these are the 4 main types of memo. Alright, so here, as I already read the question, the memo reminds a natural therapist not to. So I am just reading the paragraph first, and again I am underlining the keywords from the paragraph. Homeopathic immunization, that is the heading. Children are still suffering and dying unnecessarily from the preventable diseases of childhood. So children suffering and dying unnecessarily from the preventable diseases of childhood, whilst the incidence of these diseases had declined dramatically since immunization was introduced. There are concerns regarding parental apathy in the absence of frequent graphic reminders of these diseases. There are community misconceptions that catching the natural disease is preferable to vaccination. This is not true. The risk of complications from diseases far outweighs any risk associated with vaccination. Some natural therapists, including some well-known community identities, are promoting homeopathic regimes for immunization. There is no scientific evidence of immunity being established by homeopathic immunization as confirmed by blood tests revealing the presence of antibodies. Parents put their children's health at risk by consulting untrained homeopathic practitioners. Australian Natural Therapist Association has advised the health department that fully trained natural therapists would not advocate homeopathic medicine as a complete alternative to orthodox vaccination. As you can see here, I have just randomly marked the keywords from the paragraph. Okay, so then we are moving to the options. Option A, prevent the suffering and dying of children from diseases. Prevent suffering and dying of children from diseases. Uphold homeopathic medicines to conservative vaccines. Option C, support the false myth due to the lack of scientific evidence. Okay, so again I have marked some keywords from the options also. Alright, so what was the question? The memo reminds natural therapists not to. Okay, so as you can see here, any one of the option will be what? A contradictory option, and the other option will be not mentioned. Only one option will be the correct answer. So we can eliminate the options now. So what about option A? Prevent the suffering and dying of children from diseases. So this is contradictory, right? Because they are reminding the natural therapist not to prevent the suffering. That is how we are reading the option, right? So not to prevent the suffering and dying of children from diseases, that is wrong. That is contradictory, because here in this paragraph they have clearly mentioned what? children are still suffering and dying unnecessarily from preventable diseases of childhood. So they are not mentioned anything that not to prevent the suffering and dying of children from diseases. So option A is not the correct answer. We can eliminate option A. What about option B? Uphold homeopathic medicines to conservative action. So what do you mean by uphold? Okay. So uphold, which means what? Any idea? What is the meaning of the term? Can you please comment? What is the meaning of the term uphold? Is it mentioned anywhere in the paragraph? Uphold homeopathic medicines to conservative actions. The term uphold. Okay, very good, Monica. Advocates, support, uphold. Okay, so which is mentioned in the second last line of the paragraph. Natural therapist would not advocate homeopathic medicine. So that is actually the correct answer. So natural therapist not to uphold, not to support, not to advocate. Okay, homeopathic medicines to conservative actions, or you can say orthodox vaccination. So that is the correct answer, and we have one more option. How will you eliminate option C? Support the false myth. So nothing is mentioned in this paragraph regarding myth. Okay, misconception is mentioned here, but nothing about myth. What is myth? We can say it is a story or a folk tale. Okay, so nothing is mentioned about myth here. So that is not mentioned. So answer is option B. Okay, clear? Any doubts? Is that clear? The question? So in a memo, we are reading for the purpose, and we have to read the question first, understand the question from the keywords, and whether you can read the paragraph first, underline the keywords from the paragraph, and then you can move to the options, read the same. Okay, through elimination method, we are coming to the correct answer. Okay, so that's it. Okay, a lot of messages are here. Good afternoon once again, everyone. Lima, Amrita, Monica, Deepa, Anjana, Chinju, Mridula, Kavida, yes. Okay, yes. So that's that. Clear? Okay, very good. So now we are moving to the next part. Okay, ready? Part A. Okay, so the topic is lipodystrophy. Okay, lipodystrophy is the topic. So what about part A? So how many questions will be there in part A? Any idea? Yes, Anna, please tell me. Hi, Anna. How many questions are there in part A? Can you tell me? How many questions? Anna Joseph. How many questions in part A? We have to complete dash number of questions. How many questions? Is that 24? Anjana, we have to complete 24 questions in part A, right? Is that correct? Okay, Mridula, very good. It is 20. We have to complete 20 questions. Okay, and what about the timing? What about the timing? Tell me. Yes. Yes, Ellen, 20 questions, very good. Kavida, 20 questions. Obi, 20 questions. Yes, Obi, tell me, what about the timing? To complete this 20 questions, we have? Yes, 20. Okay. 16 minutes. Is that 16 minutes to complete part A? No. Okay, it's only you will get 15 minutes to complete part A. Clear? Okay. Alright. So within this 15 minutes of time, we have to complete 20 questions. And what is the strategy that we are using to complete part A? Any idea? To complete part B, we were using elimination method. So here in part A, we are using which strategy? Yes, Jinzi? Which strategy that we are using to complete part A within 15 minutes? Any idea? Tell me, any idea? Very good. Okay, so that is skimming and scanning. The strategy can be called skimming and scanning. So in skimming and scanning, what do you mean by skimming and scanning? Skimming, which means quick reading. We are reading the text quickly. That is skimming. Whereas scanning, which means what? We are searching for particular words or keywords from the question. Okay, so Both can be called as speed reading or fast reading. Okay, so we have 4 texts here, text A, text B, text C and text D. So within 2 minutes, okay, within 2 minutes we have to complete these 4 texts and we have to mark keywords from the texts. Okay, so when you skim and scan, we can mark some keywords from the text as I already mentioned. Okay, so what type of words you will mark? What are the keywords? How will you understand or how will you identify? These are the keywords from the texts. Any idea? What are the keywords? Or what type of words that we will mark? Could you please tell me? Could you please comment? Let me know. What are the keywords that you will mark from text A? Okay, so first of all, we can mark all the headings. Okay, all the headings, then all the subheadings, all the numbers, okay, all the names, then all the abbreviations, we can say short forms. Okay, all the abbreviations, then all the things that are related to what? Timing. The words which indicate timing. For example, now, presently, currently, early, delay, after. Okay, so the words which indicate timing. And also those words which are related to research topics or clinical observation or experiments. Okay, so for example, I can say identification, diagnosis, ascertain. Okay, and always you have to give special emphasis to all the bullet points as well as the first and last line of each and every paragraph. Clear? So this is how we are marking the key words from these 4 texts within 2 minutes. Okay, so you can read with me. Okay, we can mark some keywords from the from the text. Okay, so lipodystrophy is a general term for a group of conditions characterized by complete generalized partial loss of fat tissue, adipose tissue, certain ideas about abnormal distribution of fat tissue, multiple types, then genetic, either genetic, family. There is a abbreviation mentioned here, that is FPLD. Okay, then coming to that next point, autoimmune illness, trauma, repeated pressure, injury, specific area of the body, a loss, redistribution of fat, then again functions in your body, significant changes, then general lipodystrophy, conditions are rare but occurred, then certain medications available. Okay, then what about text B? All about the heading diagnosis. Okay, then the term mentioned here MRI, then again fat composition, structures mentioned here, comprehensive metabolic panel, then blood sample test is mentioned, measures 40 in the number. Okay, then metabolism, provider, measurements, blood sugar, liver enzymes, leptin test, then hormone, name of the hormone is mentioned there. Okay, long term basis, response to a replacement treatment. Okay, so again we are moving to text C. The title is complications. There are a lot of complications mentioned here and also subheadings are there. Okay, metabolic abnormalities, liver, heart, reproductive, other. Then coming to the treatments, we have a chart here. Okay, so treatment of this problem, leptin based treatment, non-leptin, generalized, partial. Okay, so this is how we are marking the keywords from each of the texts. Clear? Okay. Synonyms, okay, very good. Synonyms you can mark. Actually synonyms, see, synonyms we are not marking synonyms. We can say part A is a play with synonyms. Okay, so what do you mean by a synonym? The same meaning but different words. Okay, so we can say part A is all about play with synonyms. Clear? So let's move to the first question. The informant of one's body chemical balance and metabolism. So what are the keywords from the question? The informant of one's body chemical balance and metabolism. So where is it mentioned? As we know, chemical balance and metabolism, which is mentioned from which text? Text B. As you can see here, from text B, the second paragraph they have mentioned the chemical balance and metabolism, as you can see here from the second paragraph, second line. Okay, so that is from text B. Then the next question, types of disorders that could arise in the liver of individuals with lipodystrophy. Okay, so what are the keywords? Types of disorders, disorders could arise in the liver of individuals with the condition. Okay, so where is the answer? Could you please tell me, guys? Second question. Yes, Marina? What is your answer for the second question? Types of disorders. Where is it mentioned? Very good, Kavita. Second question is from text C. Okay, and where is it mentioned in text C? Any idea? Types of disorders in text C. As you can see here, in text C, they have mentioned a lot of disorders. Already I mentioned, right? Complications, type of disorders mentioned, complications. Okay, so that is from, yes, text C, a lot of disorders mentioned. Okay, so that answer is text C. Okay, third question. What about third question? What is the answer? Any idea? Please tell me what is the answer for the third question. What contributes predominantly to the prevalence of acquired lipodystrophy? Where is it mentioned? Any idea? Predominantly, prevalence, then acquired lipodystrophy. Yes. Where is it mentioned? And what is the answer to the question number 3? So that answer is text A. Okay. So which paragraph from text A? As you can see here in the final paragraph. In general, lipodystrophy conditions are rare, but acquired forms of lipodystrophy have become more common. Okay, prevalence more common due to side effects of certain medications. So that answer is from text A, the last paragraph. Okay, text A. Fifth question, under what category does diabetic therapy fall? Any idea, Kavita? About the fourth question, are you there? What about question number 4? Yes, Chinju, tell me. What is the answer to the question number 4? Strategies employed in handling partial lipodystrophy. Yes. Question number 4. Where is it mentioned? It is in text D. Okay, so that answer is from text D. So where is it mentioned in text D? As you can see here, there is a chart in text D. Okay, and they have mentioned leptin based treatment. Okay, leptin based treatment, and again this leptin based treatment is divided into 2 categories, generalized lipodystrophy and partial lipodystrophy. Okay, so that answer is strategies employed in handling partial lipodystrophy. So that is mentioned in the right side, right? So that is text D. Okay, moving to the next question, under what category does diabetic therapy fall? Okay, under what category diabetic therapy fall? What is the answer? Any idea? So please let me know. Question number 5, under what category does diabetic therapy fall? It is in text D. Again in text D. Okay, so where is it mentioned in text D? As you can see, the title itself, in text D, the title itself, it's all about treatments. Okay, and non-leptin based treatment. So they have mentioned clearly in this text D. Alright, so that is all about 5th question. So moving to the very next question, how does one acquire different forms of lipodystrophy? Okay, different forms of the condition. So where is it mentioned different forms of the condition? How does one acquire different forms of the condition? So that is from text A. Okay, so where is it mentioned in text A? As you can see here, the multiple types from the second paragraph. Okay, there are multiple types of lipodystrophy which may either genetic then or acquired. So it is either genetic or acquired. So multiple types. So that is the answer from text A. Forms, types. Alright, 7th question. A prognostic indicator for the body's responsiveness to leptin replacement therapy. Okay, a prognostic indicator. So where is it mentioned? Prognostic indicator may predict. Okay, for the body's responsiveness to leptin replacement therapy. So which is mentioned in text B. Okay, so as you can see here, in text B, they have mentioned in the final paragraph. Okay, so where is it mentioned in the text B? The last paragraph, the second last line. It may predict, okay, how your body responds to leptin replacement therapy. So that is text B. Clear? Any doubts regarding question number 1 to 7? Match the following questions. Any doubts, anyone? No. Okay, Marina, any doubts? Lima, Anu, Aishwarya, Jinsi? No doubts. Okay. So we are moving to the next set of questions, that is 8 to 14. Those are called short answer questions. You got 7 out of 7, Monica, very good. Okay, yes, good. Happy to hear that. Okay, Kavita, very good. Okay, let's move to the next set of questions that can be called short answer questions. Okay, so coming to the 8th question, which medication's improper function would warrant consideration of additional therapies for diabetes, hypertriglyceridemia? Okay, so where is it mentioned? What is the answer? Any idea, Kavita? Question number 8. What is your answer? Tell me. What is your answer? That answer is from which text? It is mentioned in text D. Yes. Where is it mentioned? Metrileptin is the answer from text D. Okay, as you can see here in the second box, okay, metrileptin is mentioned. So that is to control. Okay, so we are using metrileptin. Further treatments for diabetes and hypertriglyceridemia need to be considered if metrileptin control is unsatisfactory. So answer is metrileptin. Very good, very good. Yes, Chili, very good. Metrileptin is the answer. Yes. Okay, Sanida. Chinju got the correct answer. Monica got the correct answer. Kavita got it correct. Yes, it is metrileptin. Yes, very good. Okay, we are moving to the next question. 9th one. What substance lingering effects significantly elevates the likelihood of acquired lipodystrophy? Okay, so what is the answer to the 9th question? Any idea? Shili? Chinju, you got the answer for the 9th question? Could you please tell me what is the answer? So, which is mentioned from text A. As you can see here, from the last paragraph, they have mentioned, in general, lipodystrophy conditions are rare, but acquired forms of lipodystrophy have become more common due to side effects. So, instead of side effects, they have mentioned lingering effects. Okay, answer is what? Certain medications. Okay, so what is the answer? Certain medications. Okay, clear? Yes. So that is the answer from text A. Good. Then 10th question. What is the name of a hormone? The hormone secreted by the body fat that plays a crucial, important role in regulating body weight over an extended period. So what is the name of the hormone? So it is only mentioned in the name of the hormone, which is only mentioned in, as you can see here, in text B. Okay, so what is the name of the hormone? That is leptin. Okay, which is mentioned here from text B, the last paragraph. The name of the hormone is leptin. Leptin is a hormone your adipose tissue releases that helps your body maintain your normal weight on a long term basis. That is from the keyword, from the question. Okay. So, that is the answer, leptin. Okay, Alphonse, very good. Leptin. Sanida, leptin. Yes, Grishma, leptin. Yes, Anu, leptin. Eva got the correct answer. Monica, Kavita, yes, good, very good. That is the correct answer. 11th question. What potential consequences may arise from a deficiency in leptin, which can be addressed through the therapeutic combination of metroleptin and dietary management? What potential consequences, what are the complications may arise in from a deficiency in leptin? So, that answer is what? What is the answer? Any idea for the 11th question? Can you tell me? Aishwarya, tell me what is the answer to the question number 11? What potential consequences may arise from a deficiency in leptin? What is the answer? Do you know the answer? Any idea? Okay, so the answer is metabolic complications. Okay, so we will get the answer from metabolic complications. Where is it mentioned? It is mentioned in text D. Okay, metabolic complications they have mentioned. That is from text D, metabolic complications. So, where is it mentioned in text D? So, please tell me. Okay, Aishwarya, yes, your answer is correct. Okay, Shilly, Kavita, yes. So, where is the answer mentioned? Metabolic complications. So, as you can see here from the right side box, right, leptin based treatment, they have mentioned in the second box about the metabolic complications due to leptin deficiency from this box. Okay, yes, that is the correct answer, metabolic complications. Okay, so moving to the next question. Question number 12. How many, so we need a number, okay, how many distinct compounds are discerned within the blood through a comprehensive metabolic panel? How many? How many? Any idea? And that is mentioned, the number is mentioned in text B. As you can see here, in the second paragraph, they have mentioned something about the number. Okay, comprehensive metabolic panel. A comprehensive metabolic panel is a blood sample test that measures 14. How many? 14. Okay, so answer is from text B and answer is 14. Alright. 13th one. An instance of a genetic disorder featuring lipodystrophy. An instance, genetic disorder featuring. So, what is the answer? The question number 13. Any idea? So, what is the answer? Yes, Alphonse, do you have any idea? Question number 14. Sorry, question number 13. Sorry, yeah, question number 13. An instance of genetic disorder featuring lipodystrophy. Okay, so we will get the answer from text A, as you can see here in the second paragraph, second line. Okay, so that answer either you can write what? That abbreviation. Okay, abbreviation is mentioned here as FPLD, or else you can write familial partial lipodystrophy. Okay, familial partial lipodystrophy, or you can write FPLD. That is the correct answer from text A. Then question number 14, the last question from short answer type of questions. Okay, 14. Aside from atherosclerotic coronary heart disease, does lipodystrophy contribute to any significant cardiac complications? Okay. So, any idea, Monica, what is the correct answer? 14, question number 14. Tell me. Any idea regarding the question? So, that is which is mentioned in complication. Okay, the complications mentioned in text C. As you can see here, what is the complication? that is cardiomyopathy. Okay, from the subtitle hearts. Okay, complications from text C, answer is cardiomyopathy from text C, question number 14. So that is the answer. Alright, so we are moving to the next set of questions from 15 to 20, which are called fill in the blanks questions. Okay, so first question number 15. MRI, where is mentioned MRI? Utilizes a dash potent magnets and computational algorithms to create detailed images of internal anatomy. Okay, so where is it mentioned in the question? So from the question we have some keywords, as you can see here. What are the keywords from the question? MRI utilizes a dash, then potent magnets. So what is the correct answer? Question number 15, not 14, 15. Okay, Kavita, what is the answer? Question number 15. It is mentioned in text B, very good. Answer is from text B, I agree. Then what is the answer? It is mentioned directly here from the first paragraph itself, right? So that answer is from the first line. Whole body MRI. MRI uses a large magnet, radio waves. Okay, so that answer is radio waves. Okay, so that particular word is missing there. Fill in the blanks type of question. We have to find out what is missing there in the question. So radio waves is the correct answer. Alright, 16th one. Within the scope of a dash, meticulous attention will be directed towards the quantification of glucose levels and hepatic enzyme parameters by your healthcare provider. Okay, so what is the correct answer? Question number 16. Answer is comprehensive metabolic panel. So that is from text B, right? It is in text B, as you can see here in the second paragraph. Answer is comprehensive metabolic panel. Okay, that is from text B. So that is the correct answer. Okay, meticulous, which means specifically. Okay, as you can see here in the last line, they have mentioned your provider will be specifically looking at the measurements for your blood sugar and liver enzymes. So those are the keywords from the question. So the missing word, that is comprehensive metabolic panel. That is the answer. Okay. Okay, very good. Then next one, 17th, question number 17th. Diligent monitoring is imperative to detect the emergency of neutralizing dash in patients. What in patients? So we will get the answer from text D, as in the chart. As you can see here, it is what? Anti-leptin antibodies. That is from the last box. Okay, patients should be carefully monitored for development of neutralizing. So there are keywords from the question mentioned there in the last box. Neutralizing. Answer is anti-leptin antibodies from the last small box. Okay, so that is the correct answer. Then moving to the very next question. 18th. The acquired form may ensue post-infection dash trauma or prolonged mechanical strain confined to a specific anatomical locus. Okay, so where it is mentioned, the trauma, then prolonged mechanical strain, confined, which means controlled, localized to a specific anatomical locus. So which is the missing word here? For infection dash trauma. So the answer is in the first text, that is from text A, third paragraph. They have mentioned a lot of things. Okay, so that is infection Autoimmune illness is the answer. Answer is autoimmune illness. Okay, then 19th question. In addition to hepatic, cardiac, reproductive and metabolic aberrations, lipodystrophy also gives rise to further complications encompassing dash and proteinuric renal maladies. Okay, so where is it mentioned? It is from text C, the last box. As you can see here, answer is myopathy. Okay, from the last one, others. Myopathy is the answer from text C to question number 19. Okay, then the last question. We are moving to the last question. Any idea? The primary therapeutic regimen for dash necessitates the utilization of either oral or injectable anti-diabetic drugs in conjunction with standard lipid lowering agents. So what is the answer? Any idea? Primary therapeutic regimen. Any idea for the last question? Do you know the answer? Is it partial lipodystrophy from text D? Am I right? Okay, so the answer is partial lipodystrophy from here, as you can see here. That is the answer. Alright, so that's all about the questions. Okay, so let me know about your marks in the comments. Okay, anyone with 20 out of 20 or 19, 18? Okay, so that's that. So hope it is clear for you. So, okay Monica, you got 19, very good, very good. Okay, keep it up. So that's that. And if you have, as I'm always saying, if you have any doubts or any concerns regarding the sessions, regarding our classes, regarding the timings, you can contact the number which is mentioned here on the screen. Okay, so happy weekend, take care. God bless you all. Thank you.